Welcome. Today, you'll be learning how to perform vital signs measurements and patient assessments. In a real clinic, you will begin by introducing yourself, explaining the procedure, and then give the patient time to ask questions. This is not part of this simulation. In the vital signs measurement and patient assessment simulation, blood pressure is assessed using two numbers. The first number, known as systolic blood pressure, indicates the pressure in your arteries during heartbeats. The second number, referred to as diastolic blood pressure, indicates the pressure in your arteries when the heart rests between beats. This procedure is carried out to make sure that the blood pressure is monitored for heart health status and detect any potential issues. In the vital signs measurement and patient assessment simulation, we include thermometer and oximeter measurements to monitor temperature and oxygen levels, respectively. Additionally, we emphasize safety measures throughout the process. This procedure is conducted to ensure continuous monitoring of blood pressure to assess heart health status and detect any potential issues. Next, the patient is asked for their first name, last name and date of birth, to verify against their records that it is the correct patient. Apply the sanitizer to sanitize your hands and grab gloves. Grab the thermometer and place it in the patient's mouth. After a few seconds, remove it from the patient's mouth, then note the reading. Now, grab the oximeter and place it on the patient's right hand. Remove the oximeter after a few seconds, and then record the temperature. Wrap the blood pressure cuff over the patient's right hand. Please ensure that the blood pressure cuff is wrapped around the arm, neither too tight nor too loose. Make sure the patient is sitting in a comfortable position. Place the stethoscope over the brachial artery, which is highlighted with a red sphere. Grab the inflation bulb and squeeze it to inflate the cuff until it is inflated to approximately 200 millimeters of mercury. Use the air release valve below the inflation bulb to release the air. The systolic blood pressure value can be measured when the heart is able to first push blood. Utilize the diastolic blood pressure readings are when is the last time you hear the heartbeat when pressure is not applied to the arm, and is the moment your heart returns to rest, or is at ease with pumping blood through your system. The normal range of blood pressure in a healthy adult. Utilize the red sphere to remove the cuff and the stethoscope and place it on table, once the air is deflated from the cuff. Next, you would answer any of the patient's questions and document procedures and findings in accordance with facility policy. Great. You have done a good job at checking Sarah's blood pressure, and remember, these regular checkups help us ensure our health is in top shape. In the vital signs measurement and patient assessment simulation, the aim is to guide you through the steps of measuring a patient's vital signs, including blood pressure, temperature, and oxygen levels, while also emphasizing safety measures. This has been an example of a vital signs measurement and patient assessment simulation. Feel free to go through the experience again or go back to the home page and try a different experience.